The very first thing to do is to cut back on your salt intake because too much salt makes you retain water, and too much water in your blood vessels puts pressure on the blood vessel wall, which naturally raises blood pressure. Cutting back on salt is the key to this one, but it's not that easy because the recommended daily limit for salt is 6 grams, but in the developed world, this is often exceeded. The real key to changing your diet is to focus more on reading labels and making sure you're getting low sodium options. A lot of people think that the key to this one is the salt in the shakers, so they say, I'm going to put less salt in my cooking, or I'm going to change how I cook, but the secret is that 75% of our salt comes from our processed food diet, so things we buy in the supermarket are things that we're consuming without even knowing the salt content. The next one is weight loss. For a lot of us over this pandemic period, we've had busier jobs, we've had less time to exercise, and generally, we've probably gained a little bit of weight. The key here is we need to shift back and take control of our day-to-day life. Use rosemary, oregano, dill, and other herbs and spices instead of salt. Exercise regularly. Generally, it's said that 150 minutes of exercise in a week, and it needs to be moderate intensity. So we're talking about cycling, running, brisk walking, rowing. Anything that gets you a little bit out of breath is going to be important. You can break it up into 3 or 4 smaller sessions. Research has shown that people who exercise their heart muscles can pump blood more efficiently, and this efficient pump can also reduce your blood pressure. Deep-fried meals should be avoided. When you aim to reduce these and replace them with fruit and vegetables, such as aiming to get 5 fruit and vegetable servings per day, you will shift your diet to a much healthier type of diet, and again, this will help you lose weight and improve your blood pressure. When you're stressed, your body releases fight or flight hormones, such as cortisol and adrenaline. To reduce anxiety and discomfort, try to spend more time doing activities you enjoy, such as painting, playing video games, or engaging in other hobbies. Limit your alcohol consumption. Limiting alcohol consumption results in a reduction in blood pressure. Keep a close check on your alcohol intake because sometimes it will be a slow increase, and that's when we start to form dangerous habits. Cut back on your caffeine consumption. Caffeine is found in a variety of beverages, including chocolate, tea, coffee, sodas, and energy drinks. If you consume too much caffeine, it can narrow your blood vessels, which is never a good thing because it increases internal pressure. You have to stop smoking if you're really serious about lowering your blood pressure and you're smoking. Smoking harms your blood vessels and raises your blood pressure, practically having a double negative effect. It can also lead to a variety of other problems, such as cancer. I can't emphasize enough how crucial it is to speak with your family physician. They can provide you with alternatives, such as nicotine patches or medications that can help you stop, but it's crucial because you're going to have to make significant changes to your lifestyles, and quitting smoking will be one of the most crucial ones. Now, the most crucial decision is whether to choose lifestyle changes or medications for high blood pressure. I believe there should never be a choice between the two, and that your lifestyle characteristics will always be the most crucial aspect for pretty much all diseases. I believe that most times modern medicine is overtly prescription-based. Prescriptions are written, and then goodbye and wish you luck. You get a consultation for 10 minutes. If we don't change our lifestyle, then it's a slippery slope. I do not like to see people stuck on one medication, then another. Lifestyle factors are very important, so please put them into action and work on them. At the moment, your blood pressure may be too high to come off of your medications. Put in the work on improving your lifestyle. De-stress, eat a healthy plant-based diet, and exercise. Please like and subscribe. Stay healthy.